February is National Cancer Prevention Month, ushering in another opportunity to educate ourselves.
And Dr. Wendy McDonald joins us now to discuss cervical and vulvar cancer prevention. Thank you for being here and having this important conversation. We were just talking in the break about a preventable cancer is because you go in and get screened and tested for it.
Exactly. So here's the idea. Some cancers are pretty bad that they will surprise you. Literally, you could go to the doctor one day and you can find out the next day that you have it. But something like cervical cancer or colon cancer or vulvar cancer, if you're getting your screening, you will see from a mile away well before it's cancer. So the biggest take home is to go and get screened, to go to the doctor, ideally at least once a year.
Okay.
But we were talking about, too, doctors started a few years ago saying, okay, you only need a pap smear every 2 years.
Yes.
But is that the case?
So the guidelines are actually that you can get a pap with HPV testing every 3 to 5 years.
Oh, okay.
Which, you know, back in the day, it was yearly. Like, that was the thing. You go to the doctor, you get your pap yearly, which, by the way, the pap test is a cervical cancer screening test, specifically cervical cancer screening. So you can go to the doctor still yearly, and actually you still should, especially as a person with, you know, female parts, if you will, that you should go and get your annual exam every year. But the pap, the cervical cancer screening, doesn't have to happen every year. It can happen every 3 to 5 years. I still offer them every 2 years because I've seen a lot of things in my career, and I kind of like to just make sure that everything is okay. These are guidelines, by the way, right? These are not hard and fast rules. So if a person comes to me and says, hey, I want to have a pap every year, I say, hey, you can, you just don't need it as frequently because back to the prevention side, these cancers are very slow moving, slow growing. So you can actually space out your screening and still catch something, as in find it, detect it, well before it becomes cancer.
Okay, so I've heard of cervical cancer, colon cancer. I've never heard of vulvar cancer.
Yep, so now we're going to get into some anatomy, right? Inside of our body is the uterus, the ovaries, and even the cervix. What's on the outside is not the vagina. We often call it vagina. That's on the inside. The vulva is the outside. That is the skin and things that you can see from the outside. And people can develop cancer there. Just like you can develop like a melanoma or something on your skin, cancer can happen there too.
Oh my gosh, that's so crazy. And so now if there's no family history, can you still do that 2 to 3 year guidelines? Because even something like vulvar cancer, that's when they would do the screening for that too.
Right.
Do you, as a patient, just have to make a decision with your doctor on how often to do this? Like, what's the best plan of attack?
So the guideline is still a yearly exam, an annual exam, and that's the screening that's happening at that annual exam is really a doctor laying eyes on you, making sure that things look okay, because these are not necessarily covert cancers. It's like you'll see something, or even a person may have like a chronic itch or a chronic discomfort, and they just think, oh, that's just how life is. Meanwhile, lo and behold, it is something happening on the skin that if somebody is eye to eye with your body is going to say, oh, hey, let's biopsy that, let's check it out. So the biggest thing that one can do is go to the doctor every year and be checked out. That doesn't mean you need a pap every year. It doesn't mean you need a colonoscopy every year. But it does mean that you should check in and make sure that depending on what your symptoms are or what's happening with your body, that you're being screened.
Let's talk about HPV.
Yep.
I know that there is a vaccine out for the younger generation, the teenagers. What about older?
So the HPV vaccine is good for all humans, all genders, from ages 12 to 45.
Wow.
45, yes. And that guideline expanded a few years ago, that it actually is relevant and reduces the risk of cancer of the cervix, the vulva, which all of these things are HPV related. It reduces those cancers for all of those people. It actually probably would reduce the cancers for people over 45 as well, but the studies didn't include that population, so insurance won't pay for that population. But I have people who come in who are over 45 who are like, give me the vaccine too, and they just pay out of pocket for it. But it does substantially reduce the risk of cancer in those areas because HPV, human papillomavirus, is the virus that often causes those cancers.
And for parents, kids start getting that around 12?
They do. And the idea is preventing it before a person even has contact with other people who could have HPV is going to increase their risk of preventing it overall, right? If you haven't had any exposure to this virus yet, you're going to have the best form of attack inside of your body, you know, as an immunity is concerned.
Takeaway, go get screened, see your doctor every year. There you go. All right, Dr. Wendy, thank you so much. You can find more information with Dr. Wendy at Dr. Everywoman on social media or LukeOBGYN.com. Thanks, Dr. Wendy.
Thank you so much.